So this creator has about 250,000 followers on Instagram. She is a board certified OBGYN, and she is sitting here clearly upset that she is not able to help her patient obtain an abortion, taking the life of this unborn child due to a fetal abnormality. And there is no denying that getting the diagnosis where your unborn child has an abnormality and might not live very long after birth is an incredibly hard thing to handle. I cannot stress enough how absolutely hard that situation is, and my heart goes out to all the parents who have had to experience those situations. But let's take a step back and let's compare the two choices at hand, whether it's having an abortion because around, she says 18 to 22 weeks is usually when the anatomy scan is, so around that time you find out there's this abnormality and the child won't live very long, so you choose abortion. Or we carry out the pregnancy and give the child a chance. A lot of these situations, the parents don't want to have an abortion, and this abnormality has put them in this position where they know their child won't live very long, and maybe their doctor pushes for the abortion because of that. But your child naturally passing after they are born is very, very different than intentionally taking the life of the child in womb. Abortion is not compassionate, it's not loving, it's not merciful, it is dismemberment, and it is skull crushing, and it is suction and tearing apart of this living child. And in that situation, the parents are still going to grieve the loss of that child. But for that unborn child, the only thing they've ever known is evil and pain and hurt. Where in the other situation, the mother does carry out the pregnancy to term. She does have this child. The child lives maybe a few hours after birth. But you know the only thing that child knows? Love. That child is able to pass naturally in the arms of its mother and father. They aren't intentionally taking the life of that child. Instead, they're loving them and comforting them as they naturally pass. We would never look at a 5-year-old or a 10-year-old or a 12-year-old or a 25-year-old and say, you've been diagnosed with this terminal illness, let's just kill you now. But yet if a child in womb is diagnosed with a terminal abnormality, we would kill them right then and there? It doesn't make sense. For that person outside the womb, we would love them and we would comfort them for the short amount of life that they have left. And we should do the same for that child. Choosing abortion in the cases of fetal abnormalities may seem like a compassionate answer, but it never, never will be the compassionate choice.